Good afternoon. Hello everyone.
Hello.
Hello. So here we are for the our monthly public accountability meeting. Should we just run around the table quickly? I know we've got name badges, but it would help if I switch the microphone on. So if we just run around the table quickly and people can just say who they are. I know we've got name badges, but just for the public's benefit.
Hello, Lisa Winwood. I'm the Deputy Chief Constable of North Yorkshire Police.
Thank you.
Hello, I'm Phil Kane, Temporary Assistant Chief Constable for Local Policing.
Maria Earls, Head of Organisation and Development.
Will Naylor, Deputy Police and Crime Commissioner.
Claire Craven-Griffiths, Chief of Staff.
Richard Anderson, Superintendent, Head of Partnerships.
Sorry, Claire, just your Chief of Staff to the Chief Constable, aren't you? Just to be clear. Thank you.
Jane Newbury, Head of Commissioner.
John McFall, Unison Branch Secretary.
Good afternoon, Fraser Sampson, Interim CEO.
Tom Thorpe, Policy and Scrutiny Manager to the PCC.
And Julian Mulligan, Police and Crime Commissioner. Okay, so we have got item 1 then is apologies from Chief Constable Jones, Assistant Chief Constable Oliver and Jane Wintermeyer. Okay, so the minutes of the previous meeting. Does anybody have any comments on the minutes? I'm happy to sign them off.
Just one typo, I think, and item number 5, satisfied. But that's all.
Okay. Oh, yes. Thank you. Okay. So the actions. I think we're bringing back. Will, do you just want to pick up 210?
Yes, we effectively hadn't quite decided the best way to bring that back. National Crime Network are trying to link in with the National Rural Task Force for Fly Tipping, I think it's called. We've missed their last meeting, but amongst the members of the National Crime Network, people do attend that meeting, and it's just the information doesn't always quite get back to the middle, so we're just trying to sort of improve that communication channel. But I think both in North Yorkshire and across sort of rural communities more generally, fly tipping seems to be raising up the agenda, so it's whether there's something National Rural Crime Network can do, but whether there's something we want to pick up locally.
Okay, so I met with Caroline Johnson, who is an MP in Lincolnshire and chairs the new APPG on rural crime recently. And fly tipping is an issue that the APPG wants to pick up. So I will, when the Chief gets back, I'll pick that up with him as to how we link in with the his portfolio, what she's doing, and the NRCN. But she is going to follow up. There's a lost report, I think, in Parliament somewhere, and she's going to follow up with that.
Thank you, Commissioner. Just on the Chief's national portfolio of wildlife crime and rural affairs, fly tipping is being included in the draft national strategy for that.
Yeah, I'm aware of that. I've spoken with
priorities.
Yeah, I've spoken with the Chief about that. We had a discussion about that. I'm aware of that. Okay. I think there are wider issues around it, and there needs to be a discussion about it. It is clearly one of the things that is top of the public's concerns.
Okay.
Just on the local front, Commissioner, we've got we'll come onto it right at the end in the forward planner, but we're swapping at November and January's thematics round, so we're going to have rural next month, under which we'll probably want to look at fly tipping locally. So it will come back to this meeting within that thematic next month anyway.
Yeah, and there's some good practice with some of the local councils in North Yorkshire as well, because obviously this isn't just a policing issue, it's a local authority issue predominantly as well. And I think that's part of the problem, because the buck gets passed between the police and the local authorities. And then item 211 is on the agenda, so we'll come back to that item. Okay. So on to item 3, which is questions from the public. We have a number of questions from the public, particularly in relation to fracking. We're going to deal with those questions on item 5, because we have an operation or a review of Operation Kingfisher under item 5 on the agenda. So we'll deal with those questions then. There is one other question around the 101 information, and I'll read it out. It's from an Andrew Waits in Leyburn. And it is intelligence and information from the public helps the police keep up to date with crime, often as it is happening. Nationally, people shout for the increase in community police to get local intel. If this is correct, why on earth do we pay for the 101 information line when we make a call, and why does it take 16 minutes for someone to answer the calls? Why, as a ratepayer, should I pay to impart information to the police? Come on, for goodness sake, get your act together. You either want our help or you don't. So I'm just going to cover off the issue of call charges. We do also have an update on 101 later on in the agenda, so we'll deal with the substantive question around the performance of 101 in that agenda item. So with regard to the cost of calls, that is actually set nationally. And so local police forces have little influence over those call charges. The call charge is 15 pence, and that is regardless of how long the call is. So you don't get 15 pence per minute or whatever it is. It's a straightforward 15 pence. Some contracts, mobile phone contracts now include 101 in those contracts, and so there are sort of moves to try and make it as accessible as possible. Anything, Lisa, do you want to add anything else?
No, thank you.
No.
101's also free from a payphone for those who...
Oh, yes, from a phone box. If you can find any phone boxes, there you can use it for free.
Chair, could I just pick up an issue that so it's not so much about the charging, but it's more about the way in which part of the question might be understood by people. Of course, providing information and intelligence and so forth is as valuable as it says it there, and you do it through 101. That isn't the sole purpose of 101. And of course, people requesting help from the police in the same way would also need to be used in 101. It's only that it's non-emergency. But you could get the impression from reading that this is simply about 101 exists there just to provide intelligence for the police, which of course isn't right.
Thank you. Okay, so if we then can now move on to item 4 then. Jenny, it's a double act. Who's leading? Okay. Okay, all right. I shall hand over to you, Richard. Thank you.
Thank you. So this presentation between Jenny and myself is regarding mental health services. So the first slide just ties in our presentation, I think, quite nicely with the police and crime plan. So the police and crime plan contains an objective, a priority around caring about the vulnerable, and an objective to improve response to reduce harm to people at greater risk, including those vulnerable due to mental health. So the presentation sort of follows from that. Okay. In preparing this presentation, and we've tried to condense this down into a number of key points in terms of a vision for mental health and policing, really. And those are those coming into contact with North Yorkshire Police where mental health is a presenting issue are enabled to access appropriate support services to meet their needs, but also to reduce demand regarding calls for service where mental health is a presenting issue, and to reduce repeat calls for service where mental health is a presenting issue. Now, as you'll see from the presentation, those are two themes running through it in terms of the police role in supporting people suffering mental ill health, but also there's an inordinate demand placed on policing services in respect of mental health as well. And some of the items that Jenny and I will talk about focus on those areas as well. The outcomes are listed at the bottom of the slide there also, which are referral to appropriate support service to meet mental health needs and reducing the need for NYP calls for service where mental health is a presenting issue.
Can I just make a request? If we read all of the words out on this slide, these slides, we will be here all day.
Okay, I will give you the brief
Thank you. Thank you.
Okay, the next slide then starts at the top in terms of the governance, multi-agency partnership governance around mental health, which is the Crisis Care Concordat. That was something that was agreed nationally back in 2014, so there's a national mental health Crisis Care Concordat, and then locally, partners signed up to one locally in October of 2014. Those involve people like, well, your good self, North Yorkshire Police, TUV, Tees Esconway Valley Mental Health, mental health service provider, the CCGs, the City and County Council and other people. And that's split into a strategic meeting which meets once a quarter that obviously you attend, Commissioner, and other people at senior level from respective organisations, and then a more operational level that meets once a month, and that's headed by TUV, the Head of Adult Mental Health Services there. And the objectives and so on are set out on the slide.
Can I just ask, I mean, for the benefit of the public really then, I mean, okay, that exists, but what difference has it made? And are we confident that it's where it needs to be at the moment?
Okay. I think it's made a difference in terms of it being a forum for discussion among strategic leaders around some of the key issues. I think there's a way to go in terms of some of the further benefits that it could bring. So, for example, Jenny and I have recently been talking about some of the pressures on policing regarding performance around mental health. And I think actually we need to get some of those issues on the table a little bit more for discussion with partners at a strategic level. So I think it's a good platform, but perhaps with room for improvement.
Shall I add to that? I think it would be fair to say that actually the work that we've been able to achieve has been achieved outside of the Concordat rather than within it. Whilst it's fantastic to have partners around the table, and there is definitely a show at that table that partners are interested in working in partnership, a lot of it needs to happen outside of those forums.
Okay, so I've done some work asking other police and crime commissioners how they think the Concordat is working their areas, and I think it would be interesting if we could do a bit more of a more scientific approach to that, rather than me just sort of asking people. I do think that this needs a bit of a refresh, and I think we've got an opportunity, haven't we, towards the back end of this year where we might start to think about how we reinvigorate it locally, because I think it's probably needed.
Can I just add, I think that the challenge for us is competing priorities. You know, the things that are really important to us are only marginally important to other partners around the table. So it's kind of agreeing what's really important for us all and kind of using that as a forum to address those things, which I think, as you said, we'll have the opportunity to do that going forward.
Okay, moving on. This slide talks about something called the I4R model, and really it's a theme that's been running through our approach to mental health from a policing perspective now for a year or two, especially given our work on the Connect partnership. And basically, when we're dealing with mental health issues from a policing perspective, we're talking about identifying people who are vulnerable through mental ill health, appropriately recording issues, putting an appropriate response in place to people suffering mental ill health, ensuring that appropriate referrals are made across to other agencies who are better placed to deal with some of the issues that are presented to police, and then to review our actions accordingly. So that will be a theme that runs through some of the areas that we'll talk about later. So we're going to talk about some of our responses to mental health from a policing perspective and some of the issues around recording and so on. So as you'll see, that's just a framework to hang a number of things on, frankly. So in that spirit then, the first slide talks about the recording of mental health issues from a policing perspective. The graph that you've got on the chart there outlines something called a mental health qualifier. And basically what that means is when an incident's dealt with by North Yorkshire Police, it should have a qualifier, a tag, a badge attached to it, if the case involves a person who has or appears to be suffering from a mental disorder or mental impairment, including learning difficulties. And as you can see, 2016 and 17, the numbers that we've recorded have reached 1,400 there. So they've increased quite dramatically by about 158% actually since the early figures in 2012. However, they only account for 7% of occurrences that the police deal with, and anecdotally from other research nationally and through the College of Policing, we believe that the amount of mental health related incidents that we, the police, deal with will be higher than that. So what I'm saying to you in terms of one of the challenges from a policing perspective is to appropriately record the incidents that we're dealing with.
Okay, so Will, do you want to just pick up on that then?
Well, it begs the question, what are the barriers to recording it properly? Well, properly is not, maybe not the right term, but how far off are we getting an accurate picture, and what's stopping us getting that accurate picture?
Okay, can I just add a bit more context around that as well then, because there's a big discrepancy here between the recording, the evidence that we've got here in North Yorkshire and the often quoted figure of 40% that you find at a national level. So and actually this chart, whilst we've improved in North Yorkshire, we seem to have a real either there's a real entrenched issue here around this and recording it, or actually it isn't anywhere near 40%. So and this has been going on for 3 years, quite a long time.
So if we look at the number of occurrences where the force control room triage service are utilised, last financial year that was over I think 2,200. So we've immediately got a discrepancy between those who we're responding to in crisis and the markers that we've got on the system as well.
So I think Will spoke about barriers. What are the barriers? I think it's a process of educating, particularly within the staff within the force control room, in terms of putting these qualifiers on at point of call when they come in on the incidents. I'm meeting with the head of, deputy head of the control room and with the inspectors this week to discuss that in a little bit more detail, to understand better the blockages. Undoubtedly, training is a requirement. And it's also having that oversight from a supervision perspective, I think, also within the control room as well. You get these figures, I think, as part of the performance pack monthly at this meeting.
Which is why we're aware that this issue has not, this nut hasn't been cracked.
And whilst it's improved,
7%
whilst it's improved, it's plateauing, isn't it? So one of the later points I'm going to come on to talk about is the training that we're going to be delivering to officers across the board in the new year, based on the Connect stuff, and part of that is the recording element as well. So this isn't just North Yorkshire Police, this is a national issue as well, but there's a plan in place, as we will see from the training and from the meeting that I've outlined to you, to improve it, because my own view is it's a lot higher given the prevalence of mental health issues in the community. And from looking at incidents that we deal with, that aren't appropriately recorded.
So I suppose I won't push this anymore, but I just want to just this is really important, because if we don't understand what's going on, we can't provide the right response. And if we're commissioning services within the control room to support people with mental health issues when they present to the police, we don't actually know what it is that we need to commission if we haven't got the right baseline of data. So I would like to see some progress made on this, because we haven't made any progress on it over a substantial period of time. That number hasn't changed.
Commissioner, if I could just come in there. This is one of the areas, not just for mental health, but in terms of modern slavery, other vulnerability flags, that I'm monitoring through the operations board that I chair. So we're picking that up. Again, we're linking across with Sarah Winteringham's team around the work we're doing on niche. Richard's having that early meeting as well with the control room. So again, we are picking it up as a priority through the operations board, and we're hoping that once we get that in, we can promulgate the training through and then see an improvement in that area.
Okay. So what would be good then, when you come onto the element about training, is to try and give us a sense of timescales on this, and so that perhaps then we can decide once you finish the presentation when we might want to sort of see this come back. Yeah. Okay.
mental health funded services. So I've not called these commissioned services because I think most of us around the table are aware of the background to this, in that we haven't gone out to market with a specification and commissioned a set of providers to bid against a specification and then selected the most successful candidate. What we have done is work with our existing community mental health provider commissioned by the clinical commissioning groups in our areas, because they are the individual organisation who has access to the most appropriate data, which will help us to deliver the right services to people. So I haven't called them commission services for that purpose. Some of that comes on to why there are some challenges for us around delivering these services to the level at which we would like to. So I'll just go through the 4 services briefly. So the North Yorkshire Police Force Control Room mental health triage service. So this is a mental health nurse available 12 hours a day, 7 days a week in the force control room for officers to consult with via the telephone to be able to help them better manage a mental health incident that's ongoing within the community. In terms of the York and Scarborough street triage services, those are mental health nurses available in person on the street for 12 hours a day and for 3 days a week and 7 days a week respectively. And again, it's around officers having the availability of that expert when individuals are presenting in crisis. And the York Pathways service is a service that both North Yorkshire Police and PC's office have been involved in for a little while, but actually it initiated through the clinical commissioning group in the area and a partnership between an organisation called Lankelly Chase. But the former Deputy Chief Constable was instrumental in trying to set that up and establish it in the area. So that service is for individuals with complex needs who are placing a demand on emergency services, and its aim is to tackle the 3 hardest things in their lives in order to re-engage them or engage them with local services. This slide I won't go through in detail, but it just takes you through this, if you like, the journey we went on. So we started with street triage in Scarborough as part of the Home Office pilot, and on the back of the success of that pilot, we rolled out the service in York, and we developed the Force Control Room mental health triage service as well. The reason we did that is Scarborough and York, obviously, urban conurbations, and street triage is a service that's feasible to deliver in relation to that. However, the rest of the county is geographically diverse, and we needed a solution to make parity of access to this service available. So what we did was base that within the Force Control Room and make it a telephone-based service in order that the significant majority of the county has access to the service. The exception to that is Craven, because Craven residents are not supported under the Tears Escombe Wear Valley community-based service. However, Craven residents are supported by the First Response Community and Mental Health Service contract in their area, and our mental health nurses in the Force Control Room can access the First Response Service, and they can utilise the information that's available through that service to support triage in North Yorkshire. So that is available, and that, if you like, fills the gap in relation to the mental health service provider in our area.
Just quick question, Jenny. Obviously, one of the things that we've been having a discussion with partners around on the Concordat is whether that type of first response type service that exists in Craven might be a goer in other parts of the county. And there was some work done in, I think, the Scarborough area around that. How far are we on with that now?
I think, in all honesty, it's
died.
Yes.
It's died a death.
Yeah.
Right.
For not wanting to use that phrase, but yes, as soon as you have used it, I think, that's
right.
accurate.
Okay, yeah.
Yeah. Okay. I don't propose to go through this slide in detail, but what I will do is pick out the bullet points under current review, because I think that's probably the most important area to look at. So in relation to the Force Control Room triage service, we are looking at the moment, is the service available when it's needed? The reality is it's available for 12 hours a day. Do we want to consider a 24-hour service? That's something that we're looking at in terms of need and demand. The second bullet is around, is it resourced appropriately? There's been some discussion with TÜV as the provider that actually there is some demand for a service when the mental health nurse that's available is on a call. So would we want to look at a two-person model? Again, we're looking at that from a need and demand perspective. In terms of delivering appropriate outcomes, this is probably one of the key areas that Richard and I have been looking at, because the 3 triage-based services that we have, the offer in terms of onward services is probably not consistent. So what we're looking at is the data that we're collecting and the service that individuals get from TÜV in terms of onward referrals, and then checking up that those onward referrals are actually happening and what kind of service people are accessing. That's the key thing for us to try and get right, and we're not there yet.
Okay, so can I just replay my understanding of that then?
Yeah.
So basically, you're saying that people call into the FCR, they get a service via the mental health nurses in the FCR, they get referred into some other service, and we don't know whether they get that service or not.
That is accurate, yes.
Right.
So that is the challenge that we face. We're also challenged by the fact that at the moment the information that we're recording isn't as comprehensive as it could be. So we need to go on a journey with TÜV again about recording information and making it understandable to us and useful to us in terms of what we do next. One of the things that we haven't done as yet is being able to identify who our repeat callers are. So at the moment, the information isn't allowing us to identify individuals. It's become something of an ongoing issue that we're looking to rectify. So we need a set of data which is traceable back to individuals, and we need to be able to track to see if they're accessing the service again. At the moment, we don't have the ability to do that from an analytical and data perspective.
I presume there are other forces that have something similar. Have they done things we can learn from? Are they sort of over some of the obstacles, and can we learn elsewhere before we start doing things ourselves?
I think that at the moment I haven't found anywhere that's any further on from that perspective than us, but I'm always kind of very open to kind of having more conversations with people to understand that.
There's also a PhD student at the University of York working on street triage. Alice and links in with Bill Scott, our inspectors.
So I just want to try and just make sure I've got this then. So essentially, we are not able to access the patient data. Is that correct?
No,
the NHS...
we never anticipated
no, I know,
that we'd
exactly.
access the patient data. It was just what we wanted to be able to do is connect the occurrences where we have a mental health nurse involved, logged and recorded as individuals, so that we can then follow up and make sure, are they re-accessing the service, and then to check back with TÜV as to what service they've accessed in terms of onward referrals.
Okay, so that begs the question, why are we doing that and why are TÜV not doing that?
No, and that's absolutely where I want to get to. At the moment, the only way we could do the kind of the repeats would be via our system, i.e. are they coming back to our attention from a demand perspective? We would need to do that analysis. But TÜV absolutely should be able to provide the information in terms of onward referral and access to other services.
Does that affect our ability to refer people into pathways?
It shouldn't, no, it isn't doing, no, not that. In terms of our services, referrals into our services is absolutely fine, and we've got the right pathways in place. The challenge comes is knowing what service, from a mental health perspective, that people are referred into on the back of an occurrence where our force control and mental health services are involved. So are they on a plan with TÜV already, and therefore maybe it'll just be an escalated session on their already established plan? Are they not on a plan at all but were previously known to TÜV and mental health providers, i.e. therefore are they going to be reassessed to access that community-based service? Or would an assessment mean that they would still fall out of service anyway, and therefore would we need to think about providing a service to them?
So because if I remember rightly, one of the benefits of the evaluation of the street triage service in Scarborough was it filled this gap.
Yes.
Yes. Right, okay. So we've got a model that we know works.
We have.
Right. So the question is, how do we get the partners to engage,
Yes.
to put it politely?
Yeah, because this is quite a bit of additional work for the provider. And as I said, we haven't gone through a true commissioning process for this service. So this isn't, if you like, top of the priority list for our community-based mental health provider.
I mean, I just wonder, Chair, whether there's an opportunity for Health and Wellbeing Board, because I know in York on the Health and Wellbeing Board, there's 4 key strands of work ongoing, and one of them is a key work stream on mental health and the whole end-to-end process of the health and wellbeing of people within the city and the services, as opposed to being that repeat contact with those services. So I think definitely this is something we could pick up through the Health and Wellbeing Board, because that strategy needs to measure outcomes and success of the strategy. And that would mean anybody accessing a service, not necessarily just through the police, but through all partners in York, could share the benefit of that information.
I know you're going to talk about pathways in a moment, but the thing that is behind that is systemic change.
Yes.
And that's what we're talking about here.
Yes, and we are making those links between the Health and Wellbeing Board mental health strategy, which is an end-to-end, and the York Pathways project. Those links are being made.
So if we set up this new board that I think, Richard, that you've been talking about, then that would allow us to actually find a way of sort of docking into the places that we need to dock into to try and draw these strands together.
Yes. So what my proposal has been to develop a strategic board within North Yorkshire Police, involving North Yorkshire Police, the Police and Crime Commissioner's Office, yourself, because there are a number of strands of work now appearing around mental health, and we need to be fully sighted on the pressures within the system from a policing perspective to enable us then to have that conversation with Health and Wellbeing Board colleagues or Crisis Concordat colleagues, because there's a lot happening, as you will see from the presentation.
So from a PCC's point of view, I want to go back to that 7% again, because in effect, without that baseline, it's very difficult. Members of the public I know will be saying, why on earth is a police and crime commissioner spending money on mental health services? And, you know, surely you should be spending the money on policing services and not on health services. And until we really understand that picture and can try and develop a more sophisticated business case around this, then it's difficult to know what we should be providing from a sort of efficiency and effectiveness point of view, as well as an outcomes point of view, and for us to have those meaningful discussions with our partners, if you see what I mean.
We need to be able to measure the demand, don't we, and the repeat demand on policing, which then makes the business case as a partnership, and also on other agencies. So I'm hoping through the mental health strategy of Health and Wellbeing Board, there'll be a suite of measures in terms of outcomes that will benefit the demand impact on all agencies and not just the police. And then there's a collective desire to put those measures in place.
Of course, so that's just the York Health and Wellbeing Board, because we haven't had the engagement with the North Yorkshire Health and Wellbeing Board that perhaps we feel we might need. Yeah.
Can I just ask a very quick clarification for my own purposes? Do we know whether to log referrals from the police as a police referral? Do we know that that's a flag on their system?
So for everything that we do with them in relation to the triage services, they are logging an occurrence that they are intervening in. So we have that set of data, which is how we've developed this presentation. So in effect, from a force control room perspective, we know that we've had 3,500 occurrences that the mental health nurse has been involved in over the last 18 months. In terms of tracking those back to an individual and knowing whether that individual has repeatedly called the service, I can't get into the data that much. So that's some of the things that are important to us, because as you've just said, Commissioner, how much you're investing in the service has to have a demand reduction on the force, and I can't evidence-base that at the moment to you, and that's where I want to get to.
But we have a lot of anecdotal evidence, don't we?
We absolutely do, yes. Yeah.
Well, that was my point. So we don't have the data, I understand that. Do the mental health nurses in the control room have an understanding of how many repeat callers they're getting, because they just know the names, and how those referrals are working in practice. So we might have the data, but do they have a sense of how it's working?
I think they do, and everything that is coming back from people is very positive, from officers to the nurses involved to as a partner. However, at the moment, I can't touch it and feel it and kind of give you the reassurance that actually we're having an impact, the impact that we wanted to have with this service.
And I would add that the demand isn't just within the force control room. We're developing community safety hubs and increasing the community safety hubs to deal with a lot of mental health based issues as well, and other aspects of policing as well, apart from the control room.
Bullet points, but it alludes to the conversation we've just had, which is how do we better support those who've been previously not known to mental health services? Because the data, if we looked at that, and I know we don't want to get too much into the detail, is there are a cohort of individuals who haven't even been known to mental health services who are coming to our attention in crisis. And the reality of it is that actually not many of those, from a proportion perspective, would access TUV's mental health services in the community because they just wouldn't reach the threshold, even though they've come to us in crisis. So that kind of connects to some of the things we've been talking about in terms of what does pathways, referrals into pathways look like? Should they be from that cohort? How do we replicate a similar service in North Yorkshire so that we haven't got a gap? And would we want to refer those people into that sort of a service? How do we work with voluntary sector partners to make sure that actually there are services already available into the community that we could refer into? So some of this is about not completely knowing where TUV's referrals get to and whether people are taking up the referrals once they're referred into them. And some of it is where do we refer on to when we know we've got a set of people who aren't getting access to services.
So we're providing a sort of tip of the iceberg service, and actually the rest of the iceberg is somewhat submerged at the moment, and we can't really get our hands on where people are going and what support they're getting, and therefore whether those interventions are successful or not, and therefore whether they come back round again.
Yeah, absolutely.
Yeah.
I can't follow a pathway for an individual at the moment, and therefore I can't tell you what the positive outcome is for them or us.
But from my perspective, what I need to know is where does the money that I provide make a difference to that cycle?
As we've said that we don't want to go into the detail, I won't go into the tables, but the information is all there, and if there's any kind of follow-up questions, if people just want to email me, I'll move past this one as well. There'll be a couple of slides we go past. So, in the
Just one. So CAMS.
Yes.
Children, tiny statistics.
Yes, and I'm not confident with those statistics. So that data has only really been collected, I think, this financial year in terms of the differentiation between an adult service and a young person's service. So that data is collected, I think, under, if I just move backwards. It's this one. So under the known to services data, and that information, that kind of low 5%, is I think more to do with the fact that the detail's only really been collected this financial year rather than collected all the way through last financial year. So I think there is a data issue and there's a data integrity issue. I think the proportions will look higher for CAMS in terms of known to TUV and whether they're on an active care plan or not.
That is really worrying. So CQC obviously did I don't think it was a formal inspection, was it? It was a review that some of us participated in about 6 weeks ago, and I think the initial sort of conclusions of that are starting to emerge, and I think we do need to keep a very close eye on that wider context, because that is if you think about all of the issues around children's mental health, that is really concerning.
Yeah. And it's some of the reason why we're now collecting that information, but I'm not confident with it at the moment, and we would want to know more about, again, who are the individuals, are they coming back to our attention? I think we already can say that there'll be individuals who we know are in this cohort in terms of the individuals we know that come to our attention more often.
I mean, but quite frankly, though, we probably know as many as that through the No Wrong Door project in itself.
Yeah.
I think moving forward, it's a really important distinction to make between children and adults that we're engaging with and who are accessing services. You know, so for example, with the 136 data that I'll come on to later, you know, there was some quite startling stats there that I'll outline to you. So I think moving forward, it's really important to differentiate between children and adults.
Chair, can I ask a question? I don't think you'll have the answer on that. Apologies for being quite specific. How different are the York Street Triage and Scarborough Street Triage approach? Because looking at some of the information, the Section 136 detentions, that's like 10% in York, but way, way, way less in Scarborough. And it just strikes me that...
Yeah, the referral pathways.
Is that to do with pathways?
Yeah, and again, it's a looking at these statistics, which again we don't look at regularly in this way, which has drawn to our attention the kind of the 2%, 11% difference between both from a force control room and a Scarborough Street Triage perspective. There's 2% of those coming to our attention being referred into the 136, but in York it's much higher at 11%. There's nothing that suggests to us there's a specific reason around that as yet, but we can only know that once we kind of delve into a little more detail. But the pathways are not different, they are similar. So you would expect it to be more kind of level.
So it's the same provider, basically, isn't it?
Exactly.
Yeah.
I mean, obviously we know and understand that the way in which Two runs as a business separates York and North Yorkshire, but in terms of the processes in both areas, there shouldn't be any difference.
So from a policing perspective then, because obviously if someone's detained under Section 136, that's a policing decision, isn't it?
Yes, the actual legislation affords us the opportunity to protect that person and detain them for their own protection. We then, of course, turn to our health service providers to make an assessment of that person and how we then access services for that person in terms of protecting and supporting them in their condition. So we only are the initial protector, if you like. We then bow to the expertise of health services to make the longer term assessment of that person's mental health capacity.
Of course, that goes back to demand. You know, so if there's a different approach in Scarborough that's resulting in only 2% of people being referred to Section 136 and 11% in York, that will have a knock-on impact on the teams in York having to deal with that when actually a change in something might necessitate much less.
And it's actually just one gateway, isn't it? Because that's just one means of protecting somebody and referring them to services, when actually there are probably numerous gateways into services and even people seeking private help for mental health issues that we have no idea of in this bigger picture. It's back to the iceberg concept, isn't it, of understanding every single gateway. And I'm hoping that's where the mental health strategy will pick up all of those people rather than just the people that are being seen by statutory bodies.
Is it worth, though, on that specific issue itself, looking at the reasons behind that, in terms of that discrepancy? I mean, it might be a data recording thing, or it might be, there might be something more substantive behind it.
And it may be that people are accessing services in different ways.
Exactly. Or it may be that the services aren't there.
Yeah.
Yeah.
Yeah, so people end up in crisis more often in York for whatever reason.
It's actually not, it's not reflected in the actual numbers of 136 referrals. So the picture of 136 referrals in Scarborough and York don't follow that same trend of referrals from the triage service into that.
At the moment, though, we just don't, as Lisa just said, we don't understand the problem, don't we? So we've got to, okay.
Okay, so I'll move on to pathways, if that's okay. If there's any more queries around triage. Okay. So again, in relation to pathways, I won't go through the kind of the top side of the slide, because I briefly talked about what York Pathways is and what it hopes to achieve at the beginning. But I will say that we're under undergoing a review of pathways and our involvement in pathways going forward. So sustainability of that service into 2018-19 is something that, as a group of partners, we're all reviewing and looking at. There is a desire to see the service in place next financial year. We're also, sorry, go on.
It's just a question. Those figures,
Yes.
they're different to the figures that I've had in the past.
In terms of
I thought the
the...
CCGs were contributing some, or they have in the
They
past.
have previously,
But they're not now.
not this financial
Right,
year.
okay.
Yes. So it's just North Yorkshire Police and Lankelly Chase funding the service this financial year.
Sorry, is that a diminution of the service?
No, it isn't. It's just
No.
a change in
Right,
terms
okay.
of funders. Yeah.
Thank you.
In terms of the current view, we're also looking at whether the service currently meets North Yorkshire Police's needs, because at the moment I think we're relatively confident that actually we haven't utilised the referral pathways into that service as a force, and we could do more to make sure we kind of have clear pathways and have a clear prioritisation process into that service. In terms of delivering appropriate outcomes for individuals, again, there's some work being done by Pathways and the evaluator that they secured, but there's more detail to look at around the success of that service and whether the outcomes are those that we would look to replicate. I've just talked about the fact that we need to think about how we would prioritise access to the service going forward, and in terms of referral routes and links up to our existing triage services, that's also really important, but we've talked about that briefly already. The next...
Chair, I just wonder if it's worth quickly saying something a bit more about pathways. So we sort of jumped into the future and things, but I don't have any figures at the top of my head, but the success of the project and its sort of relative uniqueness, especially in our recent history, but it's seen A&E admissions go down and calls to emergency services go down, you know, to a really, really significant level. So it's just worth outlining the success of that, and that's why we're trying to keep the show on the road, but the public might not have some of that background.
No, and I suppose when I went down there and met with them recently, they were hoping that the final evaluation would be forthcoming at some point soon. And I know there's a board meeting coming up. Are we going to see that soon, or are they?
The evaluation report is being presented to us at the board meeting tomorrow. Good. So we'll have an indication then, but having spoken to one of the people involved in the research project, because mental health episodes are cyclical, they're saying we would benefit from a longitudinal study, because we can show the immediate success of access to services, but the true proof in the pudding will be if those people remain outside of crisis for a lengthy period of time because of the cyclical nature of their access to services.
Okay, so we're wanting to showcase the success of this project next week. So I'm assuming then that the content of that report will be available to help us do that.
Yes.
Yes, good.
Yeah.
Excellent.
And I think, it is important to say that the data on this slide, whilst it's not detailed, does indicate that for the individuals involved in the project, they have self-reported the benefits of this service to them, and also the professionals involved in this service in terms of them monitoring across key dimensions in the what they call the multidimensional change management tool, has seen a shift across a number of dimensions for individuals who have very complex needs. So they're those who have the most complex needs probably in York, not necessarily from a police perspective in terms of referrals into the service, but definitely from a blue light perspective or an emergency service perspective. So that is really positive.
I think also it's not just about the quantitative data of access to services. So there are service users who sit on the board, and it's really powerful listening to their personal stories about the quality of service and the difference that it's making to their quality of life. So it's not just about the numbers. I think we also need to make sure we capture the service users and their quality of life and how they feel about access to those services and how they feel about themselves, which is what the multidimensional change management tool measures.
I was just also going to say that whilst we don't have a significant cohort that we've referred into pathways from an MIP perspective, we're just looking as to whether it's feasible or worthwhile to do a demand piece of work from our perspective with those people who were on our caseload. So we're just going to have a look at that with corporate performance.
So presumably that goes back to that conversation that we had earlier, though, about not being able to identify those people who are on that sort of cycle.
Yeah, I mean, the reality of this data is we can track it back to individuals, I think, and we can create that cohort and then look at them with corporate performance in terms of repeats. We can do the same with our data for the triage services. At the moment, I just don't have the ability because the data isn't in that format. We can get to that place. I'm not saying we can't, it's just I'm not there yet. So we can track back to individuals, I just haven't got that accessible and I couldn't provide it for you today.
Okay, and I suppose just for anybody watching, to be clear that all of the relevant information sharing protocols are in place and all the data protection stuff is in place on all of this, just to make that crystal clear as well.
They are, absolutely.
Yeah.
Sorry, while we're clarifying, can I just clarify that? So the outputs we've got up there, Q1 and Q2, 18, 19.
Sorry, that should say 17,
Yeah.
18.
Thank you. That's just thought I'd misread it. I thought this, yeah, okay, thank you.
Right. And I'll hand back over to Richard.
Sorry, Jenny, can I just, I suppose, because it looks like a lot of money for a very small number of people at the moment, and so that evaluation is really important.
It really is, and I think that, as we've said before, these are really complex cases and they're individuals with multiple needs. And I think, you know, whilst I didn't mention it specifically, on this slide it does say initially Pathways clients were less hopeful, motivated, resilient, trusting, impulsive than any other group they were compared with. So these are individuals facing real challenges, and actually this project has helped them significantly.
And actually, if you look at the challenges more broadly that are facing authorities, these are exactly the type of people that we need to be able to find something that can support.
Absolutely, and I think for me, one of the things that would be important to us next financial year, if this service continues, is making sure that we can identify the fact that these individuals are re-engaged with local services. So we know that we can't continue to provide this type of intensive service for long periods of time. We need to think about exit plans, but exit plans that work for the individuals.
Okay, so this next slide just outlines a number of developments. First thing, Chair, I just want to point out is that North Yorkshire Police have a dedicated police inspector working on mental health, which is a really good resource given the issues we've been speaking about. And I'd just like to publicly acknowledge Inspector Bill Scott's role in a lot of the mental health work. Just a fantastic job does Bill. So this slide then talks about some of the developments. I won't go into all the detail. The first point about health-based places safety I'll come on to separately regarding 136 and that. CAMS crisis service, I think it's just worth mentioning there because there's been a sporadic approach to CAMS services. That's children and adult mental health services across the county over recent years. What I can tell you that the Hambleton-Richmondshire service became operational in May 2017, followed by the service at Scarborough, and then more latterly at Harrogate in September. Okay, so it's, you know, again, it's an emerging service around the county, and I think it's really important. We've already mentioned the support to young people already around the table.
So there's been a lot of talk about more money going into this nationally. Are we starting to see any of it filter down to local services?
Well, I think evidenced by the fact that there are the new services in place across the county, yeah, that can only be the case. So I think the next point, connect there, I'm going to come on to a little bit later on. Bill Scott, again, is doing a lot of work with the City of York Council, particularly around suicide prevention and the Suicide Safe City initiative there, being led by Sharon Stoltz, Director of Public Health for the City of York. Lincoln Sargent, the counterpart for the county, is linked in with that work also, and so involved in that also. Across North Yorkshire in 2016, 82 people took their own lives suicide. So it's a real and present issue for communities in North Yorkshire.
And can you I just want to set that in context. How does that compare, for example, to deaths on the road or through sort of criminal activities?
It's a lot higher. Yeah, it's a lot higher than people killed on the road or through homicide type offences. Yeah. Some other developments of the course of the last year. I think we're one of 2 forces in the country that have produced a problem profile regarding mental health. And that's been sent through to the MPCC National Lead. There was a call came out last week for work around this. So that's good. It's a really good document, and I'd like to introduce it to the Mental Health Strategic Board once we get it up and running, because there's some good stuff in there for discussion. The other good development is we've just signed off the North Yorkshire Police mental health policy for officers and staff, which links into a myriad of different procedures and protocols with partner agencies, but for the first time consolidates all of that into one place for officers and staff in North Yorkshire. I can't do this presentation without mentioning that HMIC have recently been into force. We're in last week for their effectiveness inspection, a key component of which focused on mental health and policing. And we'll await, obviously, the formal outcome of that, their findings in respect of North Yorkshire Police. There's other items I know, focus pathway. We're trialling something in Scarborough and also at Harrogate with the Community Safety Hub in terms of some more focused work around mental health cases. I've already mentioned that the Community Safety Hubs deal with a lot of mental health cases. This is, in effect, trialling a different way along the lines of the York Pathways model, so referring cases from Community Safety Hubs into a TUV-led meeting for discussion. It's early days yet in terms of the outcome and effectiveness of that, so I won't dwell on that. We've got some work ongoing at the moment in terms of looking at an approved mental health practitioner working in the force control room in the new year. Can't say for definite if that's going to happen, but there's some good work ongoing at the moment to try and get that up and running. Mental health training for staff, I'll come on to with the Connect Partnership work. I think a key one for this meeting, and perhaps awareness for yourselves, is the changes to the Mental Health Act that are being introduced following the Policing and Crime Act amendments. They're likely to come into force in December of this year, which will be quite impactful on policing and indeed on partners.
Can you just explain how?
Yes,
Thank you.
I can. So the key points. Well, first of all, there'll be a complete statutory bar on detaining young people in a police station after they've been detained by a police officer. As it is already, I think we have virtually no young people detained in a police station for a mental health issue.
It's worth pointing out, actually, that's a real success story because when I first came into post, there were significant numbers of young people going into custody.
Yeah, Commissioner, just to clarify that that's just for detention under 136 not arrest.
No, I understand, but there were still, yeah.
Yes, but that will now for the first time be outlined in statute. I think the other part associated with all that would be, at the moment, when people are detained by police officers who are suffering mental ill health, they can be taken to either a health-based place of safety, which is an increasing use of in North Yorkshire, or a police station, which we really don't like to see happen because there's not all the health support in place. The new provisions will bring in a rule whereby it will only be in exceptional circumstances that people can be taken to a police station, and there are some further checks and balances introduced into that. So one of them will be a police inspector has to authorise it. So a police inspector will have oversight of that initially. In any event, for any detention of a person by a police officer in a public place, there will be such a requirement for that police officer to consult with a health professional, and there's a number of different people that meet that criteria so for example our street triage and our FCR triage would meet the requirements. So again, but these are now being brought into place by statutory measure. I think, so that... Yeah.
So just going back to the earlier point then about whether or not we need 24/7 cover, does that link in with that?
I think there are a number of health professionals we can link in
there are,
with, so we wouldn't necessarily have to, but we could look
Yeah.
at the scope of that, but I think there will be national set people who will be on duty 24/7, so it might be somebody who already works at the hospital who has to be contacted, for example, rather than us providing that service.
Because I was just thinking that there's been an issue with provision generally, access to mental health services, AMPs and all the like, and I was thinking if we're having to rely on that within that timescale, that might be problematic, but...
There are some regulations under the Act being laid before Parliament which will outline the specific categories of people, and I think, for example, it may include paramedics and so on, but there is also some draft guidance being produced centrally to support everybody in this.
Just on that point, though, it would be really important for us to monitor that from point of inception in terms of contact with her, because we've discussed today already, haven't we, sometimes the lack of data is our downfall, or we don't understand the problem. So getting ahead of the game, it would be good to be able to record on niche the contact and how accessible the person was and up to what percentage of access we're either providing ourselves through triage or we're accessing the services provided by the general health sector.
For example, sorry, that's challenging with appropriate adults, so because the management information just isn't there to know how well it's provided, so it's hard to hold sort of people to account, if that's the right phrase.
Yeah, and I think the other risk for us that we've got to monitor in terms of, I think we can do this through Richard's group, is officers being tied up monitoring individuals that have been detained whilst they're awaiting health services to take the assessment. So that could actually have a negative impact on our ability to deliver against demand. So.
And I think one of the challenges, you talked about challenges and so on earlier, the guidance is much more prescriptive in my view in terms of routing people towards a health-based place of safety rather than the police station. It's only in exceptional circumstances that they should be going to a police station, and therefore the challenge I think for partners is to ensure that they're equipped, resourced and so on in their health-based place of safety to deal with perhaps slightly more agitated individuals rather than police officers.
And that's been a challenge for a while, hasn't it? And I suppose, how do we feel that partners are approaching that?
Well, this has been on the slow burn now for quite some time since the bill was in play, bill being considered by Parliament and then the Act passed and so on, and Bill's engaged with partners. I know it's been discussed at the Crisis Care Concordat meeting also. I think we started off this conversation talking about the Crisis Care Concordat, and I think there's a real role for the Crisis Care Concordat in terms of overview and governance of how these new provisions will operate. There needs to be real, in my view, quite tight overview, frankly. There are other aspects under the Act. It redefines the locations where the power can be exercised. So, for example, there's essentially a bar on detaining a person in their own house under the Section 136 provision, but essentially anywhere else would apply. Could apply. And a reduction in the amount of time that a person can be detained under these provisions. Currently, it's 72 hours. The new provisions will reduce that down to 24 hours. It can be extended in a police setting by a further 12 hours, but on the authority of a superintendent. But I see those circumstances being few and far between, frankly, as a superintendent.
Can I ask Richard, do we given the numbers of detentions in custody are already pretty low and have come down over the years, are we already at the exceptional circumstances stage, or do we see them coming down to almost zero, if not zero, after the Act is...
Yeah, I think that's going to be the ambition, frankly, Will. I think in terms of 136 detentions, North Yorkshire, we've had some comparative data through from HMIC in terms of where we're at nationally, and we're about mid-range. So in terms of detention, that's detentions for 136 overall, the number of detentions in police stations is going down markedly in North Yorkshire. I think one of the things I'd just like to raise, again regarding children, we are an outlier force though, in terms of detaining young people under 136 in North Yorkshire. We are the highest of any force in the country, and I don't honestly know the reasons why. Last year, there were 33 separate occasions where young people were detained, 26 individuals. And this is an interesting set of data because it's the first time that HMIC have actually published this sort of data, so we can compare ourselves against other forces, if you like. There are some repeat people in there. You know, one hypothesis could be because of the lack of a cameras provision or other services in North Yorkshire. I don't honestly know the answer, but it's, from my perspective, as an operational policing officer, it's a worrying factor. And they are predominantly girls.
Rosie, do you want to come in?
Thank you. Just briefly, so the something you said there about this being expanded, I presume it is the definition of public place that's then being redefined. Because of course, a lot of the focus traditionally has been on the post-removal side of this, i.e. where are people taken to a place of safety. But of course, this has always been a statutory power of removal for a police officer, to remove the person from a public place because they appear incapable of looking after themselves. So it's very much a pure safeguarding for that person found in extremis in a public place, power that each officer has individually. And that's often missed. But actually, if the statutory definition of where that power of removal can be deployed by a police officer is now going to be expanded, that in itself would be a very relevant change in legislation, wouldn't it? Because it is very much a last resort power that an officer's got in their toolkit, which distinguishes it completely from it being any type of arrest. It is a temporary removal in their own best interest, but until now, it's been in a public place. And so you can't use it in private premises at all, can you?
I have a practical example then, because so for example, it has been known for security staff in hospitals to ask police officers to come onto premises to detain people. Would that, and that's been a bit of a grey area, and I've you know what I mean, that's a sort of practical example of.
So I think the new provisions clear up the grey areas, and the guidance that accompanies it clears up the grey areas. So in that circumstances, yes, the power would be available. 136 puts a prohibition on detaining a person in any house, flat or room where the person or any other person is living, or any yard, garden, garage or outhouse that is used in connection with the house, flat or room, other than one that is also used in connection with one or more of those houses, flats or rooms. So anywhere else, it would apply.
Okay, so potentially we could get more calls from hospitals. Yes.
It's conceivable, yes. Yeah.
Can I ask if I just get back a bit to the children detained under Section 136?
Yes.
I could be wrong. I seem to remember in a version of this pack a long time ago, not this thematic, but the performance pack, we had children as a separate figure. At the moment, we'll see later, we just get detentions under Section 136, whether, given we're an outlier, we want to bring that back on a monthly basis to just see if anything we're doing to improve that is showing.
Yeah. That is also an issue that we're raising with both children's safeguarding boards, because quite amazingly, having sat on those boards for 18 months, it's not been raised as an issue, which and I don't know whether that's because it's not visible. We didn't know about it till HMIC pulled the figures out, so we need to also explore, and our health partners are sitting around the table there, so there should be some perhaps work to do with whether they're accessing services by a different route.
Yeah.
But also the fact that there's a gender skew as well, which is really interesting, isn't it? Because commonly what people say is it tends to be the sort of larger violent young people that are detained, but this data would suggest that perhaps isn't the case.
Definitely, yeah.
I think also it's a growing problem, because I know the Health and Wellbeing Board have done a survey work of students in York, and there's some really worrying signs in terms of young people and how they feel in terms of their mental well-being, and those problems are then going to manifest themselves throughout their lives. So I think it's also something that's a growing problem as opposed to something that is diminishing. Definitely, and it's concerning for me that we're an outlier, you know, in terms of all the other forces.
So we're on section 136, the amendments to the Mental Health Act. There are other things that the Act brings into place, but I've covered off the main ones. Okay.
Is it worth just saying that, given that we're going to look at a strategic board, that there's a really important piece of work around what data comes to that board, which allows us to then strategically take that to other boards and make sure partners are kind of fully in the loop. I know there's a piece of work that Richard's organised with Corporate Performance for us later in the week to look at that, isn't there, or to start that off.
I think so, most definitely. For me, there's a raft of data out there that we need to understand. Sorry, the last bullet point.
So Richard, sorry Jenny, because that's important, because we do struggle sometimes with the resources on all of this, don't we? So if you haven't got what you need, then we need to be aware of that. Yeah. Okay.
The last bullet point on there just simply mentions the new mental health hospital in York being built on Haxby Road, due for completion 2019. Right, so this next slide does concern the number of Section 136 Mental Health Act detentions, 2016-17. The numbers on there, 351 in that period for North Yorkshire Police. As I say, we're not an outliner in totality across forces, but there obviously are variations within those figures over demand in different policing areas. So obviously Scarborough sticks out there, doesn't it, as being at 110. That's the highest amount.
So Richard, obviously there's been issues in York, hasn't there, with availability? Presumably this doesn't reflect that, though. Is this after?
Yeah, this is after.
Right, fine, okay, all right. The other question is with regards to Northallerton.
Yes.
And what happens with that?
So there, I think you're talking about Friarage Hospital.
I am.
Okay. So there's a consultation ongoing from CCG.
The likelihood is they're going to close it.
So
not the hospital, although that let's not go there, shall we? But the section 136 suite. My question is if they are going to close it, have they done the work looking at where those people are going to go, and have they joined up the dots either north or south?
Basically, I mean, we've put our views forward just to work it through in the light of what I've just said. If a police officer detains a person in a public place, then the first place that they should look to take them is a health-based place of safety and not a police station. In this time frame, Northallerton place of safety was used on 65 occasions. Okay, if that isn't there, then those people would have to go to another health-based place of safety in the county, Harrogate.
Or north.
Or north.
Yeah.
So they could go into, the ones in Cleveland, Darlington and Teeswan. So there are other options available, but from a policing perspective, it would impact.
So my question is are we given? I mean, obviously there's a consultation going on at the moment, but given this, is the scenario planning sufficient scenario planning going on within North Yorkshire Police and within the NHS to deal with this issue if that closes? Because that's what we need to be reassured.
And the numbers are only going one way, given what we've talked about with the Mental Health Act.
Yeah, I mean, engagement's been made. I mean, if you don't mind me saying, I think this will be an appropriate one also for the Crisis Care Concordat meeting as well, because it's a clear mental health-based issue amongst partners. And we're dealing with the system here, aren't we? So as one part of the system takes one piece of action, it impacts on another part of the system.
And that's the bit that, because of the fragmented landscape that we've got around the NHS in North Yorkshire, whether that system is joined up enough.
Yeah, I've engaged with Bill Scott and Richard in relation to this, Commissioner. I think what we're asked Bill to do as a direct liaison for us with the health services is look at if that place of safety 136 suite is not available in Northallerton, then what other alternatives are there for us, not just for 136 suites, but actually what other preventive measures could be put in place, street triage, etc., in that area as well. So Bill's looking at that with the health services.
But there have also been some significant issues with accessing services north outside of North Yorkshire as well, haven't there? So those linkages have not been in place, and there have been some significant issues. Sorry, just this is a risk, isn't it? So I suppose I'm flagging it as a risk and asking how NYP is mitigating this risk.
Yeah, so at the moment, that's where the dedicated inspectors linking in with the health services in that area to make sure that we've got sufficient provision to deal with those 65 occasions that we've got. Yes, there will be the occasions where we would have to do the increased travel to take an individual to Harrogate, but actually what would we be able to put in place with the health services to reduce that 65 down? And that's what Bill's looking at.
It's the last bullet point, I think, Richard, but it also links into transportation and who's taking these people where, and if those 65 are being taken somewhere else, who's taking them, and what impacts that having on policing?
And I think, again, well, that's an important point. So under the protocols we have in place with the Yorkshire Ambulance Service, and this is why I think it's important for discussion of the Concordat, because the Yorkshire Ambulance Service is part of the Concordat meeting, is...
Actually, it'd be nice if they turned up, Richard.
Yes, well, the point I was going to make...
to be blunt, but...
is the way the system should work is if once a police officer detains an individual in a public place, then there's an agreement with the Yorkshire Ambulance Service to transport that person. They should arrive within 30 minutes to transport that person to a health-based place of safety. For a variety of reasons, that sometimes doesn't happen, probably about 50% of occasions. Sometimes that's partly down to the police officer not doing that or doing it a different way. Sometimes it's to do with issues concerning the Yorkshire Ambulance Service. I think it's an area that we need to work on collectively with the Yorkshire Ambulance Service, if I'm honest. But the Triage issue will also impact on the Yorkshire Ambulance Service as well as the police. Sorry, the bit above that, 87% decrease in the use of custody for detention over the past 5 years, and I think that's a great success.
And actually, we have been a little bit, or I have been a little bit negative about the health service. That actually is because we've made real improvements over the past few years.
Yeah.
So, yeah.
I mean, that's an 87% reduction on people, well, with high needs being detained in a police station. And that's really good. And the figures, just a bit of detail, 46 people detained in police stations in 2015, 31 in 2016, and 14 so far in 2017. And we've had some 0 months as well, which has been quite good. So, I think that's a lot on 136.
Chair, can we just stay on that slide? You're expecting to raise this, but it's a public meeting. Bradford. Up here, up there. That's, so members of the public are looking at this, of course. Bradford isn't ours. The population almost is equals everybody else on the list. But I'm advised over here, sotto voce from Tom, that's probably just the Craven bit.
It is
but it would
big...
be confusing if you were looking at this.
Well, also my question is that Airedale or is it actually Bradford? Because that's a question too. But
that's the section 136 in Bradford.
But where we take people.
Where the Craven.
So that's not all the people
but there's
from
one
Bradford
in
going to Bradford.
No, I
going
understand that, but there's one in Airedale. Airedale Hospital has a suite, doesn't it? Yeah.
It's well.
So because obviously for Craven officers,
yes.
Airedale is a lot easier than Bradford.
Yes, it's 5 people being taken from the Craven district that way. Being
a resident of Craven district, I understand this.
But there are very few people. 5 people. Yes. Good. Right. Moving on. I wanted to just end on something called the Connect Mental Health Partnership. And this was a project for which we received funding from the Police Knowledge Fund, jointly with the University of York in 2015. And there's been a whole raft and programme of different work ongoing since it's now finished. I think one of the key deliverables, one of the key successes of the programme has been focused work around mental health training for police officers and staff. So that was delivered on a pilot basis to a large number of officers, about 300 officers last year. It was fully evaluated, such as a randomised control trial and other methods of evaluation, and we are rolling that out, getting back to the point you raised originally, some of the detail, to officers and staff in the fourth quarter, that's from January to March of 2018. Sorry.
So how many people have actually been trained at the moment, and how many people will be trained? And actually, is this product, quote unquote, available to other partners like the fire service, for example?
Right, okay, number of questions there. So in the pilot, there, touching on 300 people were trained, okay. And they were predominantly response PCs, sergeants and neighbourhood officers and PCSOs. It was done on a randomised control trial basis, so different pockets around the force. Then the academics did an evaluation of that. Quantitative and qualitative approaches were taken to that. The training that was delivered also reflected the learning outcomes from the National College of Policing programme that they've put in place. So the training that our officers and staff get in meet the national requirements, but there's an added value, in my view, in that it's been thoroughly researched from an academic perspective. It was delivered by staff from Tees, Escombe, Wear Valley Mental Health Trust. So the course, quite different to the College of Policing course, was delivered by mental health practitioners. And following the evaluation, that's come back as being one of the key successes, because we've actually had people who work on the street triage team and other, the FCR Triage, delivering the material to police officers, and they can bring in their own experiences to it. It's a wonderful package. I've sat through it all. There's some great stuff in there around practical issues that police officers encounter on a daily basis. So Bill's working on that at the moment. We've tweaked it slightly. So another piece of work, obviously, regarding the Youth Commission. One of their priorities is around mental health and young people. We've been able to bring those into that to tweak some of the training to get a bit of more of a flavour for the aspect for young people. So that's been a good success. I've talked a lot about young people today, so that's been an important part. And that'll be rolled out to officers and staff early next year. But I also, and again, Bill's working with the training team on this, there's a need for mental health training for force control staff, people who work on our front counters that have got public contact as well, and again that's in our sites also. So.
Okay, so what I'd really, is it possible for that evaluation, is that evaluation public?
The evaluation of the pilot's already taken place, yes. So there are a raft of papers. We are meeting with you on the 29th of November.
Excellent.
To discuss all this stuff. That's myself, Bill, Professor Martin Smith, who is a principal investigator, head of politics from the University of York, and Carlos Solar, one of the academics.
I know
also.
Carlos, yeah.
Yeah, so we'll be coming to talk to you about this in a bit more detail on the 29th. One of the other aspects that I think you'll be particularly interested in, given the comments so far, the policy issues around the system that Martin's been leading. He's done quite a good paper on some of the policy issues around mental health and the system and why it perhaps might not be working nationally and locally. And I think that will also be a good item to discuss at the Mental Health Concordat meeting also.
All right, and which is in, okay, that is very helpful. So, because we got, was it £2 million for the Connect?
There's £1 million.
£1 million, yeah, for the Connect project. So the question is then, what is the ongoing commitment around the cost of that training? So presumably will be, is that factored into our budgets or not?
Yes, so in terms of the cost moving forward, the training plans and so on, and all the material has been delivered. The TUV, the mental health delivers, have agreed to deliver the training again, free of charge.
Excellent.
Moving forward, which again I think is a great example of partnership.
Yeah, that's really good.
Between police
and
the health. So No training's at zero cost. There's
Yeah.
obviously the staff time cost, but it's well invested. There are lots of other aspects to the Connect programme. So there was part of the thinking around developing links between academia and police forces was to develop evidence-based policing aspects as well. So there's been a whole host of work around that. They've funded some master's programmes at the University of York for staff. They've done a number of systematic reviews around mental health related issues that are of relevance to policing more broadly. Some of these will be presented at the college later on, I think in November. So there's a whole host of legacy issues arising from the Connect Mental Health partnership.
All right, that's really helpful. So I will wait until the end of November then for that further conversation about that. But I suppose I know from talking to frontline officers how much they value this mental health training, and I suppose it's making sure that we do get that rolled out, and also going back to my point about the fire service, whether or not there is a product that we can use that could be rolled out to some of their staff. If appropriate, and certainly they feel that they are engaging with vulnerable people in a way that very much the police service are, and that type of training will be valuable.
I think, in direct answer to your question, I think as the programme stands currently, it would need modifying.
Yeah.
This is very much aimed at police
Policing,
officers and powers and so on and so forth. But some of the inputs there around the availability of other services and so on, I think would be right. But it would take a piece of work to do that.
Okay.
Separately, there is another piece of training that we are engaged in on a regional basis called Respond training around mental health. And that's like an immersive type training. There was a couple of sessions last week that Bull was involved with a number of other inspectors. And I know the fire service get involved in that, whether it's the local North Yorkshire Fire Rescue Service or not, I don't know.
Okay.
But there certainly is potential to develop our product for...
Okay, so clearly I have a business case in with the Home Secretary around governance of the fire service. Once we get an indication of the direction of travel of that, what I'd like to see is a piece of work around what the fire service might need in respect of this.
It might be worth doing a non-police version, because I think at the Crisis Care Concordat I last attended, there was interest from other sectors like A&E, for example, and other places that's a non-policing version of that training might be generally helpful.
So that's perhaps a wider piece of work then that we need to pick up.
Just to pick up on that point, Will's right. Dr Nicola Moran, who led on the training element, went to the Crisis Concordat meeting and delivered on the training to the panel. And you're right. I think the benefits of training are increased if it takes part in a multi-agency situation where people from a range of backgrounds are working together on the training. So,
okay, brilliant. Thank you. Tom?
Just because it's very different often kind of sitting behind this table, around this table, or back in the OPCC and looking at, 54% of all our calls for service are mental health related, and we get very used to, and for the public on the other end, probably just hearing all these numbers is one thing. I was out with the response team on a Saturday night a few weeks ago, and aside from the nighttime economy demand, the majority of the work they were doing was mental health related. And I just want to say that I was really impressed actually by the way they dealt with it. Going back to your point, Commissioner, in terms of the desire for training, that was really evident. But it was really impressive. And I was just a little shocked. I knew what the numbers were, but I was shocked at the actual amount of work they have to do around mental health. So that was just, I wanted to just paint a slightly different picture.
And just very quickly on the journey, I think we touched on it a few times in that presentation, but the steps that have been taken since 2013, 2014, I know officers on the ground find street triage and the control, all these things extremely helpful and seem to be helping them do their job and deal with people better, and hopefully the outcomes are better for those people as well, albeit data's missing a little bit. But, the steps we've taken have made a difference, that those incremental steps have been felt.
That's it then. Thank you very much. Thank you. So we've now on to item 5, which... Sorry, Mike. Just Okay, brilliant. Thank you, Simon. Thank you very much. So, policing update, Kirby Misperton.
Okay, thank you, Commissioner. I don't know if I've gone the right way there. So essentially, what I'll do is I'll try and give you an update and also incorporate some of the answers to the questions that we had from members of the public at the beginning of the session. So again, if I'm not able to incorporate all of those answers, then we'll ensure that we'll give you a written response that we can provide out to the public for them to view.
Yes, so we'll so just on that then. So if we don't cover off specific questions that we've had, we will, from those that were submitted in advance, answer them within 24 hours.
Yes.
Any additional ones that we have in over the course of this meeting, we will aim to correlate those with the answers that we've already given, and then try and answer any additional ones as quickly as we can.
Yes, well, yes.
Okay,
no
and I also just, I suppose, want to say that some of those questions talk about the sort of potential relationship between police and crime commissioners, policy and operational policing. Just want to make it absolutely clear that the Chief Constable deals with the operational policing, and in actual fact, local police and crime commissioners have nothing to do with the policy either, because this is a policy that is set by central government and has been implemented through the various different local decision-making bodies like the County Council for permissions and all of the rest of it. So we very much take a sort of neutral stance in terms of the policy in all of this, and this is really an operational process that the Chief Constable is in charge of.
Yes, absolutely. And what I'm outlining here is the operational response to hydraulic fracturing in the Kirby Misperton area. And again, before I go on to outline the strategic intent in relation to North Yorkshire Police's response to that, just to provide an overview in terms of that command structure that we have in place. So again, we have a gold commander at Assistant Chief Constable level who's dedicated to Operation Kingfisher in terms of the primary commander for that. That isn't me, so I'll do my best to answer the questions. Unfortunately, they're on leave at the moment, so if there's anything that I can't answer, we'll ensure that they're answered when the commander comes back. There is then a dedicated silver commander reporting up to the gold commander. The gold commander reports directly to the Chief Constable with regards to that. And then there's a range of bronze commanders sitting underneath that carry out various functions. So all are qualified public order commanders, nationally qualified, nationally registered public order commanders, and experienced in the roles of activity that they're seeing. So in relation to an overview of the strategic position for North Yorkshire Police, essentially for us, it's looking at how we, through the European Convention of Human Rights, provide a policing response that meets the convention rights for all parties concerned in relation to the activity taking place in Kirby Misperton. Now, whether that is local communities, whether that is those that are against hydraulic fracturing, whether that's the businesses that are actually carrying out the hydraulic fracturing, or whether that's local businesses in the surrounding area as well. So again, for us as a police service, it's about providing a proportionate response in relation to the activity that's taking place that aims to balance all those fundamental rights of all concerned. And I think, as you can see from the slide that's there, again, there is no weight in any direction in relation to that. The police service aims to remain impartial in the way that it discharges its duty, and again to support the rights of all concerned. Now, again, there are occasions where we have to take necessary action in relation to activity that's been undertaken, but again, that's in relation to continue to balance those rights and in line with domestic legislation that's applied by those qualified commanders on the ground and the silver commander in the control room. So, for me, where are we in relation to Operation Kingfisher? So the traffic management plan, which is authorised by North Yorkshire County Council, has been published, and that shows that we're a third of the way into the operation at this stage, with phase 2 of the 6 phases almost complete. So the next phase that we're approaching is phase 3, which we expected to commence on the 26th of October. So it's anticipated this phase will last for approximately 6 weeks, and there'll be significant vehicle movements in and around the site during this time. And again, all the vehicle movements are displayed on the site, on the PowerPoint there, and are already public knowledge in relation to the traffic management plan. So, timescales wise, again, we should see that move over the next 6 weeks, again, increased vehicle activity. So, again, we'll be maintaining our strategic approach to supporting that plan that's been delivered there, and also supporting any anti-hydraulic fracturing activity that takes place in relation to peaceful protest.
I just want to sort of try and sort of put this in layman's language then, because there'll be people who are very familiar with this and people who are less familiar with this. So in effect, phases 1 and 2 were the sort of preparation works.
Yeah.
And then phase 3 is when you get the main vehicle movements, the lorries, coming in and out of the site as they actually inject the water, chemicals and sand into the ground, and then that releases the gas, and then that produces the gas, and then they're into the production of the gas.
I think that's it, yes.
In a nutshell. Yes. Okay. I'm no scientist in all of this, so that the phase 3 then you say is going to last about 6 weeks, and that's the majority of those lorry movements.
Yes.
Yeah.
That's right. So essentially, in terms of areas of responsibility, and again trying to answer some of the questions that have been submitted prior to the meeting, the traffic management plan is not authorised by North Yorkshire Police. That's North Yorkshire County Council that do that on the following the request of Third Energy that submit that request. Again, the fencing around the site is not North Yorkshire Police's fencing. We haven't placed that up. Again, that's between Third Energy and North Yorkshire County Council. And again, as the clearway and the that's been declared, again, is not a police power to declare a clearway. It's a council power in relation to that. So again, they're all elements that from within the questions we're being asked in relation to what powers are the police using. They are not police powers in relation to that. They are not enforced by the police. So in terms of what legislation we are using, the Silver Commander will utilise domestic legislation under various acts, taking cognizance of European Convention of Human Rights in relation to achieving the strategy and the strategic intention that's outlined on the first slide. What I can confirm in relation to one of the questions, North Yorkshire Police has not and has no intention of using Terrorism Act 2000 powers in relation to dealing with this protest. They have not been utilised. So, with regards to, again, costs that are published. Sorry.
I just want to pick up on some of the questions around policy. There's quite a few questions around policy and who is directing the policy. I think it needs to be clear that there isn't a policy that anybody is being directed by here. This is legislation that you are following in order to do your job.
Yeah, absolutely. There is no central government or other policy that directs how we police in relation to this or the outcomes that are seeking to be achieved. The only area that the Silver Commander is working to is to achieve the gold strategy, which is in line with the European Convention of Human Rights.
Phil, this might be an unfair question, apologies. Is there somewhere easily accessible to understand use of force tactics and things like that? Because I suspect that will be a number of questions from protesters will be around that those kinds of powers.
Yes, so again, use of force is, again, there is no separate legislation that we utilise in relation to that. So there will be the general powers that we have for day-to-day policing, as we would any other situation. So whether that's common law powers, Criminal Law Act, or powers under Police and Criminal Evidence Act. So they are where we draw the ability to use force with regards to when we're making arrests, or actually if we're preventing somebody from entering a situation we feel that they're putting themselves or others into a public safety situation. So again, that's where we would draw the use of force from in relation to that, and that's where the lawful powers come from.
Thanks.
So going on to the financial costs, again, on the slides there, I just must reiterate there that these are not the total costs for policing Operation Kingfisher. These are the additional costs that we're seeing over and above what our normal policing costs would be. So they don't include the cost of officers that are deployed, so it doesn't include their wages, etc., other than the overtime that they may incur. So again, these are just over and above the normal costs of providing police officers on a day-to-day basis.
Sorry, and I just want to sort of clarify that. So in drawing up these figures, essentially, we've said that the police officers are employed anyway, and
yes,
their wages are being paid in any event.
Yes.
Were we to need to request financial assistance from the government at some point in the future, we can only do so on the basis of a certain threshold being made, which is 1% of our overall budget, which is roughly £1.5 million. And it would be only the additional cost that we would be able to seek recompense for in any event over that. And therefore, this is why we've published the figures in this format. Once the operation is complete and over, then it may be that we publish the total cost, including the hours of police officers deployed and all of the rest of it. But at this moment in time, that is operationally not appropriate.
Yeah, that's right, Commissioner, and that falls in line with every other force in the country in terms of how they presented their financial information during an operation. So it's not just in relation to this operation. It would be any policing operation. We wouldn't publish the entire costs in relation to that. So again, it would put us at a tactical disadvantage.
Yeah, but in the interest of transparency, those costs will be published when there isn't an operational risk associated with them.
Yes.
Yeah.
Can I just say as well, this is the first time we've published this information for this operation, and we'll do the same additional costs each month now until the operation's over, and we'll then discuss them at this meeting if they need discussing, but they'll always come back to this meeting while the operation's ongoing. So this won't be it. The public will get this updated once each month. Okay,
so in relation to arrest and disposal, so as you can see, up to the point that the presentation was produced, again, obviously there's potential for changing daily with regards to the number of arrests. There have been 26 arrests made linked to the operation. Of those 26, we had 22 individuals charged to court. Some of those who are now been through the court process and are going through the court process from earlier on this week. 2 have received police cautions, and there were 2 where there was no further action taken. With regards to community, the local community, again, we'll continue to engage with the local community using our neighbourhood policing model, as we have done. And again, as there's acknowledgement, there are some members of the community that are against hydraulic fracturing. There are some members of the community that are for hydraulic fracturing. Actually, in terms of our policing engagement with those, it's irrespective which way individuals' personal beliefs are. We continue to engage through a neighbourhood approach, and we're seeing some positive responses in relation to that engagement with the local community as well, as some concerns that have been raised in relation to the questions. So for me, I think that we're continuing with that relationship, and that relationship will continue long after the operation's finished as well.
And I would just sort of like to reiterate that, because obviously the Office of Police and Crime Commissioner has received correspondence around this as well, and we have received a variety of correspondence as well. So I think, you know, we'll read it all with interest.
Yeah. Okay. Again, as for our officers that are deployed, again, I know there's been concerns raised in relation to whether they are for or against hydraulic fracturing. Again, for us, it's not a matter for that for policing. Policing will remain impartial. Officers deployed to the operation, as with any other form of policing, will leave the personal views to one side, and then we'll deliver the tactics and police it impartially as per the oath that was taken in the attestation. So in terms of regards to the overview of Operation Kingfisher, that concludes the slides. Commissioner, I don't know if there's any other questions that you want to ask in relation to that.
Just very quickly, could you, just for the benefit of the public, because a number of these correspondence has indicated that protesters feel like they are being subjected to kettling, as it's commonly known tactics. Can you just clarify the position for North Yorkshire Police on the use of kettling, please?
Okay. Kettling is not an official tactic that's utilised. Okay, it's a terminology that's used by individuals that believe that when they are hemmed in, for want of a better phrase, to an area. Now, we would only ever use a situation where we prevent somebody coming onto a road or stepping in front of a HGV in this operation where we feel that they're putting themselves at risk. Now, there are occasions as well where we've been advised by the fire service or the council that a temporary structure that's been put up by some of the anti-hydraulic fracturing group is unsafe. Now, if that's the case, then we have a duty under Article 2 of the European Convention of Human Rights to ensure that people around that structure are safe and well. Now, if that means that we would have to move those individuals out of the way in case that structure collapses on top of that group, then we have to do that. And again, we have the ability again under law to utilise force to be able to move people out of the way to ensure that they and others are safe. So in terms of kettling, for us, it's not about controlling people and keeping them in. It's about preventing individuals from putting themselves or others in a place where they could cause harm to themselves or others. And it's about preventing them from going somewhere as opposed to from keeping them in somewhere.
Can I just clarify, in any situation like that, if a member of the public requested that they needed to visit some amenities or for whatever reason wanted to leave the area, they would be able to do so as long as it was safe to do so?
Yeah, absolutely. The officers on the ground will apply on an individual basis. If an individual says, I no longer wish to be here and want to leave the area and can do so safely, then absolutely they would be allowed to do so.
And then there's a few questions around the welfare of police officers. I think perhaps that's important to touch on as well.
Yeah, so again, we've engaged with our occupational health service. We've also engaged with the military community in relation to providing our officers with sufficient occupational health care after they've been on the operation. So once they've been deployed, there's an ability for them to go through what we call a decompression phase, where they can have access to occupational health and debrief situations where, again, we can talk the officers through in terms of what their experiences are at the site. So, and again, they're lessons that we're picking up from other forces and we've put in place to ensure that our officers' well-being is maintained.
Okay, thank you. Has anybody got any other questions? Nope. Okay.
Again, point of lawyer's pedantry, but you'd expect me to raise it. Of course, there are questions in there about the welfare of officers and the approach of North Yorkshire Police Authority. Of course, there is no North Yorkshire Police Authority, hasn't been since 2012. There's the PCC.
Thank you. Okay. Thank you very much. So, as I say, we will make sure that there are written responses to those questions, and if there are additional ones, we will deal with them outside of this meeting due to time, but we will endeavour to get them published as quickly as we can. So we've now got item 6. So, Lisa, I think this is an exceptions. Oh, Phil. Okay, all right. It's got your name on it. Okay, brilliant. Fantastic, thank you.
Okay, Commissioner. So again, I'll say that there's lots of information on the slides. I'll go through a snapshot in relation to it. Some of the information is repeated from previous meetings, so I won't intend to go through that. As an overview, North Yorkshire maintains the lowest crime rate per 1,000 population in England. Again, still number one in England in relation to crime levels.
Can I just say thank you to all of the police and staff and volunteers and everybody who's made that happen. So, thank you.
Okay, thank you. So in relation to two long-standing crime trends, again, we're still seeing the rise in sexual offences and violence without injury. However, when you compare those against our most similar forces, which are the ones that Her Majesty's Inspector Constabulary deem that we are most like across the country, we're still ranked first or second in relation to those crime types. Of those most similar forces, we maintain the lowest levels of crime in those particular areas, albeit we're not complacent in relation to that, and we still want to drive those down as best we can, or ensure that where we are recording they're going up is because we're training the true picture of what's taking place out there. So call handling, I shall leave till later on in the agenda, if that's okay. Satisfaction rates remain high, with 8 in 10 victims satisfied with service, and from our domestic violence survey, we're showing positive returns in relation to those victim surveys that have been conducted there. And again, our public confidence levels are showing a slight increase on last year. In relation to volume crime changes, again, I think everyone will have seen the national data that's come out showing a 13% rise nationally. However, for us, yes, we're seeing an increase. However, it's around about 5% for North Yorkshire, so we're well below what the national average is in relation to crime site increases. We have seen a spate of robberies over in Harrogate in July and August, and again, they were mainly carried out by young persons. Arrests have been made, and they're progressing through the investigations at this time. So, with regards to antisocial behaviour, have I clicked too far? Sorry. Again, we're seeing a 5% reduction on antisocial behaviour compared to this time last year. Public safety and welfare, the long-term trend is up, and I think, you know, when we're looking at safeguarding areas and linking across to Richard and Jenny's presentation on mental health, this is probably where we're seeing it. I know some of the demand work that we've looked at has placed mental health demand in the top 3 in relation to demand being faced by the force. So killed and seriously injured on our roads, we're seeing a long-term trend of down, which is good news. There's no emerging issues in relation to that. Ongoing tactical responses. So for Craven, Hamilton, Richmond and Harrogate area, again, we're seeing a dedicated operation now in Valley Gardens area for antisocial behaviour. That's undertaken with our partners. Operation SIFT is continuing in relation to the OCG group, Organised Crime Group, that's based in Harrogate. And again, there's a dedicated partnership approach in relation to that as well. Scarborough Rydale has seen a number of operations targeting what we call the county lines drugs issues that we're facing with organised crime groups coming from larger metropolitan areas and dealing in our town centres. So again, and then there's Operation Contribute, which is targeting modern day slavery and human trafficking in Scarborough Town Centre. Again, at the moment, we're looking at an emerging picture, working with our partners to see what the particular issues are there. In particular, I think we're facing issues around the Bulgarian community at the moment, and we're looking at what that essentially what that looks like.
So I think at some point we need to just bear in mind the HMIC's report that came out today around modern slavery, and have a look at North Yorkshire in light of that. So if we can put that down as an action, that would be good.
Yes. Okay. York and Selby, Operation Confiscate is running, which is York outer area. That's particularly the Chapel Fields area on west side, which is increased antisocial behaviour around the use of mopeds. And just to clarify, that's not the robberies or the acid attack type mopeds they've experienced in London. This is just about antisocial behaviour use of them. And again, leading up to the Christmas period, Operation Erase and Safari will be up and running in relation to the city centre and around nighttime economy. Okay,
so just very quickly, a heads up, I had a surgery in Ripon yesterday where we had a number of people come in and talk about motorcycles and mopeds in the city centre at night, taxi drivers reporting, seeing all sorts of things. So I just flagged that's something that came up in the surgery in Ripon yesterday.
Okay, I'll make sure that the commander for the area is made aware of that.
Thank you.
Also around delivery companies as well, at late at night.
That's mainly a noise issue, I think.
Yeah.
Okay. Rural Crime Task Force. So again, we've got 2 further wildlife crime officers trained. That takes us to a cohort of 20 in the force now. There's a number of proactive dates planned around poaching and prevention activity for crime in rural areas. So again, one of the examples for that is £100,000 worth of farm equipment stolen from North Yorkshire, Cleveland, Durham has been recovered in the Durham area, and we're ongoing in relation to trying to trace where they may have come from and get those back to the owners. So again, there's Operation Crackdown taking place, which is a scored organised crime group that's operating in the north of the county and predominantly involved in rural crime. And again, we're linking in with our partner agencies there to take some proactive operations around those. So further responses, again, we've got Operation Hawk and Operation Checkpoint running. Operation Checkpoint is a multi-force operation. So we've got linked across with 24 Farm Watch volunteers and North Yorkshire police officers from our proactive teams are carrying out cross-border patrols targeting cross-border and rural crime committed by offenders coming into the North Yorkshire area. So on the 13th of September that resulted in 35 vehicles being stopped, 8 searches, 4 fixed penalties and 3 vehicles being seized.
Phil, I'm just conscious of time.
Yeah,
if you want to sort of pull the key themes out.
Okay, so I'll move on to victim-based crime. So again, we're seeing some rises in Richmondshire, Harrogate and Selby areas. So again, predominantly in relation to Richmondshire, it's been commercial burglaries. Again, there's an operation in place with the inspector there to counteract in relation to those. Harrogate, we've seen again, we've spoken about Operation Shift and the robberies. There's arrests been made in relation to those, and again, we're putting some additional proactive policing support into those areas. And Selby, again, it was a part of it is a historical in relation to the TUMBs that have taken place there, but we're seeing a rise in shoplifting in Selby, and again, there's problem-solving plans in place for that.
So we have had representations again from Selby around some of the increases in crime down there. So I think reassurance around that is important.
Yeah, I've engaged with the area commander covering that area, and they've reviewed their problem-solving plans. They've got plans in place, and again, we're supporting those with additional proactive police and resources. Okay. Antisocial behaviour, I think the main one to mention there was the Harrogate one, which is we've seen the operation is in place now around Valley Gardens, and that essentially is the operational element of the performance pack.
So we've got HR.
So people, let's go on to the people data. So again, what we're seeing there, 1st of November we're launching another police officer recruitment campaign. Again, this one's going to be focused on diversity and inclusion. So we're looking at increasing our representation from underrepresented groups. So 28 student officers arrived with us this month. There's 28 transferees scheduled for January 2018, and a further 28 student officers will be scheduled for March 2018 as well.
And Lisa, you'll touch on the recruitment in the control room when you come to that. Okay.
Yeah, and then the final...
we've done that.
So this is the mental health slide.
Yeah.
Just of note in relation to that one, Commissioner, no 136 in custody in August at all.
Good.
And that's it for the performance data.
All right, okay. So, Lisa, thank you, Phil. Lisa, can we go on to the FCR update? I just want to say, obviously, this is a priority for a lot of people, it will be fair to say.
Yes, including myself.
Yeah.
So, in respect of this, it's just to note, I think, that because of the dates when reports have been prepared, there's only 2 weeks difference between the data that was shown at the last performance meeting and this one. So there's some highlights in red so we don't go through the same data again, and it is only 2 weeks worth of data in terms of the changes. I think the really important thing for me is we recognise that contacting us on the telephone is the main source of contact to policing, so this is a really important issue to us. We want it to be an exemplary service. We know the Buzz did a lot of research in years gone by about what's acceptable in terms of call handling, and we want to meet those expectations of the public in terms of handling our 999 calls within 10 seconds and our 101 calls within a minute to answer those calls, and we'll show some of the statistics of us working towards those targets. The staff themselves in the control room are working really hard. I know that the Commissioner and your staff and myself and some of our senior leadership team have been in the control room a lot. They really care about delivering that service, and they are trying their utmost to keep that service standard going. And obviously we're trying to support while we make the changes we're making. The position we find ourselves in is in relation mainly to we deliver a better quality of service in terms of introducing Thrive, which I'm sure was talked about at previous meetings, which means that delivering right first time service through having a longer conversation with people on the telephone obviously takes up more time, but delivers a better service. That didn't affect our call handling statistics until there was an unforeseen increase in national call handling volumes, so not just North Yorkshire, across the country, and that's found us in a position where we can't service that demand. The complexity of the equipment that's now in the control rooms means that in years gone by, I've worked in a control room where you just go in and answer the phone and there's a button to press to use the radio. It's fairly complex equipment. I know that members of the public and other organisations have contacted us. They have visited the control room so they can see the complexity of the kit and equipment and the length of time it takes to actually train people. So this is not a case of demand's gone up and we haven't put the staff in. We can't do it overnight as a result of the complexity of the kit and equipment.
Can I just say, I think that is a really important point, because I think there's a sort of feeling that somehow or other this isn't, we can magically switch a button and solve all the problems in the control room, that this is going to take time. And the issues have sort of built up over time, and they've reached a sort of critical point. And it's going to take time to deal with them. And I think everybody recognises that. And so we recognise that the service isn't as good as we would like it at the moment.
Yes.
But also we would still encourage people to call. And if they do have to wait, then bear with us. But also make use of the callback facility that we've put in place, because it is good.
Thank you. So moving on to the area and probably answering Mr Waite's question is the next two slides about the call handling times, which I think is what is relevant to most people that will probably be watching. So when you look at the increase in 999 demand in comparison with previous years, just to give you an idea that the demand has gone up between 6,000 and 9,000 calls. So it's the equivalent of us handling 5 months worth of calls in 4 months on the 39 system. So if you look at the tables further down, as you can see, in total, the difference over the last 2 years has been an increase in over 5,000 999 calls during that 4 month period, which is significant in terms of that. When you look at the call handling times, as we've said, we're trying to achieve 10 seconds. I'm really pleased to report, we watch the statistics every single day. And we speak to our staff in the control room every single day. On Sunday, we achieved a 59-second average call handling for 101 and 6 seconds for 999 calls. We'd like to achieve that every day. We know we're not doing it at the moment, but that's what we aspire to. So as you can see, we are moving in the right direction now that certain measures have been put in place. If you look at the 2017 column on here, from June through to September, we're down to a call handling average of 12 seconds for 39s now. And I appreciate the average is 16.5 over those 4 months, but the trajectory of travel is going in the right direction, and we want that down to 10 seconds consistently. So moving on to 101 performance, and this specifically relates to the second part of Mr Waite's question, other than the actual costs. As you can see here, there haven't been quite the same level of demands in 999s. There is potentially a connection between the 101s and 999s, so people are not wanting to wait on the 101, getting frustrated and then ringing 39s. So we think some of our increase in call handling on 9s is probably as a result of people not wanting to wait on 101, and I would really urge people not to use the 39 system for anything other than emergencies. We do understand the frustration, but as the Commissioner said, the callback facility now is a fantastic facility. It tells you how long you're going to wait for somebody to call you back. It means that you can free up your time, and the control room will ring you back as soon as an operator is free.
And can I say that is generally pretty quick, so you don't have to hang around for hours and then waiting for a callback. The callback comes usually within a few minutes.
Yes. So I think the highlights on this particular slide I would like to emphasise is the average time to answer in seconds, as you can see, has come down from over 200 seconds down to in September 139. I appreciate that is not where we want it to be. We've said we want to answer within a minute and we'll continue to work towards that target, but it's certainly going again in the right direction as a result of some of the measures we've taken. The abandonment rate has also seen an improvement in terms of, and I'll just explain a little bit about abandonment rate, that some forces deem a call to be answered the minute the switchboard kicks in. We don't think that's answering a call for service because we care about quality as well as quantity. So we deal with abandonments when the person presses the button of who they want to speak to. So if they press 1 for inquirer, and once that goes through onto the inquirer line, if somebody then abandons the call, we measure the abandonment, whereas we're being measured against some national statistics where people are showing fantastically reduced abandonment rates, but they deem as soon as the switchboard answers the phone to have answered the phone. And we don't think that's a fair assessment for the customer that their call has actually been answered. So moving on in terms of what actions we're taking that are, one, showing these performance improvements, if I can get the slides to go, and why we think those performance improvements are starting to show green shoots and will continue. We've got a goal group running, which has been running since July. There's a silver meeting every week, and then I touch base from a monthly perspective on a gold overview of those silver actions in the action plan. Mindful of time, I won't go into every single bullet point on these slides and just the key points.
Yeah. So there have been some requests for us to publish an action list. This is all in the public domain and has been for quite some time, so there's no question of hiding this. So sorry, go on.
Just a quick one, Lisa. We're essentially seeing the signs of all the different things that are being done. Is that a North Yorkshire level improvement, or are there also is there anything done nationally? Either is demand coming? Are we seeing demand come down, or is there anything else that might be not North Yorkshire?
Okay, I think you'll find on one of the further slides on, or try to find under the national, there is no national data set available for this. There is a data set around 3/9's performance and the number of calls that go to 2 minutes or drop onto another line in another force, but there isn't a generic data set that's held nationally for call handling, so it's very difficult to measure nationally.
I suppose, are you seeing other chief constables or deputy chief constables saying, oh, ours is starting to improve as well, or do we feel like we're further ahead than others?
Not wanted to speak out of turn, and obviously haven't, so I won't name any forces. Those forces who have physically increased the numbers of staff within their control rooms to physically answer calls are seeing improvements. And that seems to be the key measure of success, if you like, from most of the other forces.
Thanks.
John?
Thanks. I can clarify, since this issue was brought here in February to yourself, the force through the deputy have worked immensely. The gold meeting that's been set up has come up with numerous recommendations that's been put through to Silver. They are now been actioned. As you said earlier, it does take time. The main issue is recruitment. We have an ongoing programme now of recruitment within the control room. This will keep going all the way through next year. We're doing everything we possibly can to make sure that every call is answered. The improvements in there to date have been really fast and really effective. It will take more time. I would like to think by February, March time, we should be hitting the targets and getting where we should have been 6 months ago. To answer the question regarding the rest of the country, I've been in touch with most of the control rooms throughout the country, and they're all having the same problems, and it was all unforeseen. It just all of a sudden increase went through the roof, and of course a lot of cutbacks within the service have meant that we didn't have enough staff to deal with what we had, and of course now we're recruiting to massive new numbers of calls coming in. But the plans are there, it's going to work. The staff morale is slowly rising, and we're getting on top of it. And I've got to say the deputy has taken a lot of work and personal interest in this to make sure it does, and it's paying off.
So, John, can I just thank your members for all the work that they've done as well, because and you personally for the work that you've done, because you've been a consistent champion for the control room, for your staff in the control room. So, thank you very much.
Thank you, John. I'd echo those thanks. It's been helpful to have your support, and physically visibility in the control room means a lot to the staff. as well in terms of your support. So moving on to the next slide, and I will not sort of dwell on each of these bullet points, but in terms of hold for operators, so other forces, PSNI have the lead chief officer in their force for call handling and control room. They gave us some advice when they did a peer review about they found their switchboard made a huge difference because people are often just inquiring about something. They don't actually need to have a full Thrive phone call with anybody. We've returned to a hold for operator function. As you can see from the numbers here, 8,000 calls were answered on the operator line in August and 8,500 in September. That's a lot of people. And generally they want initial advice about something, put me through to a department, quick query, etc. So that's taken a lot of pressure off because they're a different skill. So we can bring people into the operator function role much more quickly, and it can also create an initial role in the control room that people then see what the job is about and might stay with us from a career progression perspective.
So I think it would be fair to say, wasn't it, that when there was when the changes were made, 2010, that there was a view that the 101 could answer these types of calls. What's happened is that the 101 has been answering these type of calls instead of the calls that they should be answering, and so now you put this back in so they can deal with sort of administrative calls and allow 101 to focus on the calls that they should be focusing on.
Yes. Yeah. So moving on to the second tranche, Q-Buster's already been mentioned. This is a really excellent service in terms of people being able to be called back by the service rather than hanging on the phone. So links to Mr. Waite's question about sitting on the phone for 16 minutes. Actually, you can opt for Q-Buster and it will ring you back, and that's proving really successful. In September, we average 117 calls per day using this service.
Can I just clarify, because we've had some feedback because people will be going, well, where is this? It hasn't been offered to me. My understanding is that it kicks in if the wait time is above a certain...
Yes, so if they press an option for the inquirer line and they want to speak to somebody and then they're waiting to speak to somebody, we will set a limit of, actually we can see that the call handling is busy at the moment. So when you ring some organisations and you get the message, there's really high call volume at the minute, do you either want to hang on, do you want to ring back later, do you want us to call you? We set a limit of actually how long we can see the calls are going to take to answer, and therefore we will give people the opportunity to be called back and tell them how long it's going to take to call back.
So sometimes that's not available because the calls are being answered quickly enough.
Yeah.
And actually, when you go into the control room, you can see on the boards exactly how long the calls are waiting for and whether or not. And then you can vary the amount of time that people are waiting for depending upon the capacity. So sometimes it might be 2 minutes, sometimes it might be 5 minutes, depending upon the volume of calls and what you've got available. Yeah.
And if we can answer straight away, we will. We don't want to ring people back if we can answer straight away. But once we can see those, and we can monitor the Q-Buster and how long it's taking us to ring people back on Q-Buster.
Just very quickly, I did ring call back today. I think it kicked in about 3 minutes-ish, give or take. I wasn't recording it, but that's when the option came in, so I clicked it. I don't think it's in here, Lisa, but there's lots of information, so it could be squirreled away somewhere. The question I've had from Twitter was about a 16-minute wait.
Yes.
Is there a way to sort of gather some of those outliers? Because I know that will, well, that is an outlier because the average is much lower than that. But we occasionally get things in the office about 4-hour waits or things, which I know just don't happen. So it might be helpful to sort of bookend that expectation, so we know, that it very rarely happens, but.
I don't think it's in these slides. We can produce a chart. So every single day, the control room, deployment managers, and Jane Larkin as the call handling manager for the whole team, knows exactly how long the longest person has had to wait on that particular day. So we can measure that and have a chart of average speed to answer and longest wait, if that would be helpful.
Something like that, happy to figure out in the meeting.
So then just in terms of the recruitment that we touched on in the HR section earlier, so just the updates are in red here. So since the 9th of October, we've got 11 comms and 5 dispatchers have started their classroom-based training. So they'll be accredited by the 22nd of December, and it just shows you how long it takes. It's a real skill for somebody, if you think about the sort of incidents that they're dispatching to, and they are the lifeline of the officers and the public that we're serving. So it is a really intensive course, and we have to be sure that they're accredited and fit for purpose in terms of that role. A further 9 comms and 11 dispatchers are going to be recruited in January. We're just going through an assessment of 120 candidates, so we've just run a recruitment campaign. And I know from the update on that, we've got some really good candidates that have come through the interview process.
I have to say, when I was in the control room last, I met one of the new recruits, fantastic people, really great, really fantastic, really loving the job and enthusiastic about it. So it was really good to see.
That's good. And we're hoping to create that career path for people of coming as an operator, then become a call handler, then become a dispatcher. So we've got an opportunity to retain people as well as we don't want particularly a huge churn of people once we've got skilled people in there. So that's helpful also. And then just the further training courses planned, as John has already alluded to, in April, August, October, and then the following January. So we're mindful people do want to go on and do other jobs in North Yorkshire Police, which is to our benefit, but that also means we need to keep up the recruitment in the control room. Oh, I'm going backwards. That's not helpful. Okay, CROM I'll very quickly touch on because it was touched on last time. So we, on the advice again of the peer review, people are more efficient and effective if they stick to a specific task. And we were finding that people who were call handling and then jumping to crime recording and then going back to call handling are not as efficient or effective in terms of delivering the service. So we've separated out the crime recording occurrence management element of the control room. And again, that's starting to reap benefits in terms of them becoming specialists in crime recording and occurrence management and allowing people to focus on serving the public in the control room. So we think that has had an impact on some of the stats that we've shown in terms of abandonment rates, and the speed of answer coming down.
This may be a complete, that might be off the mark here, but is there an opportunity if those people are becoming more specialist in crime recording and CROM, that with regard to the recording of mental health, that provides an opportunity? Yes.
Absolutely.
Okay, right.
And I think separating those two things out, the initial recording of a mental health related incident isn't sometimes always apparent until afterwards. And therefore the fact that we train those specialists to spot actually there is a link here when they come to record it, or occurrence management closure codes. So there's a real opportunity. There's also an opportunity with these in particular individuals, because they have control room skills, to provide a resilient bank of people for us. So if they've already worked in there, what we find is, because it's such a specialist skill, once you've run out, whereas we've got another group of people here now who've got the requisite skills that could potentially provide that backup support when we need the additional staff. So that's helped as well from a resilience perspective. This is the national context you mentioned earlier, Will. There just isn't a national data set. Certain things are gathered, and we're not comparing apples with apples in terms of measuring the first point of contact at switchboard, etc.
Okay, so I had opportunity to contact a neighbouring force, which shall remain nameless, and it took at least 18 minutes for them to answer the 101 number. So I know from personal experience that this is an issue.
And just to highlight on here that we're not an outlier from those national stats that do exist. It doesn't mean it's right, and we're not satisfied with that performance. So we're not complacent that it's okay because we're in line with the national average. We want to be exemplary in this particular area of business. Moving on.
Inappropriate calls.
Yeah, so there's a demand context here. This just gives an indication of the sorts of graded responses we're dealing with in terms of percentages of calls. So an immediate is you've got a crisis, an emergency, and we want to get there within 15 minutes. Urban, 20 minutes. Rural. So that's about 17% of our calls for service. And as you can see, the biggest percentage is other, where we deal with appointments and slower time related incident reports from the public. And then just the types of calls that we receive. As you can see, in respect of antisocial behaviour, public safety and welfare, which we've talked about today already at length in terms of we're not sure that that's reflective of the true amounts, and crime and administration. And then I think just finishing off is just a plea to the public, I think, in terms of the types of calls for service that we receive. We absolutely, as Mr. Waite has alluded to, we want the public to call us and give us that really essential intelligence and information that helps us to deliver a better service, gives us intelligence about who's committing crime and antisocial behaviour so that we can respond to it. But we can only do that if we're dealing with the right calls and we're spending our time efficiently and effectively on those calls that matter. So this is just a selection of calls that we have received on 101, and we continue to receive these sorts of calls about people wanting to know when supermarkets are open, wanting us to pick property up for them, reporting that their village don't shop in Tesco's, so they're really concerned about the Tesco's van being in the village, etc. And it's just a real plea. We absolutely want to hear from people in respect of our contact with the community and the essential information that you have, but we can only do that if people call us when it's relevant. And I'm happy to take any questions.
We've overrun by 20 minutes, but we did have quite a lot on the agenda, so my apologies for keeping people here and out there. Does anybody have any questions? I mean, no?
Not on that, and obviously it comes back every month at the moment, so
Yes.
if the public have got questions, they're more than welcome to ask it in time for the next one.
Yes.
Or we'll try and answer it before, obviously, but they're more than welcome to raise anything they've heard today next time.
But we'll produce the outliers. Is that be helpful? Quickest and longest time to answer?
Yeah.
It gives an indicator, because a mean or an average is just an average, isn't it? And it would be helpful to have those outliers.
I think there was one Jane did where percentage of calls under 10 seconds and over sort of 10 minutes. So you don't have to go to the extreme, but it's helpful to know the sort of ratios of how quickly things are answered.
And I just hope that people have got a sense from this sort of quick canter through of all the work that is being done, that there's a huge amount of work going on here. And not least a considerable amount of money being spent on this to put this back to where it needs to be. So it is something that is obviously exercising the public, but is exercising all of us as well. Okay. So I'm going back now.
We've got forward planner next.
Yes.
Just so the public know, we're swapping the offender management unit and rural around. So what's on the forward planner that we've published is now out of date. We'll republish that so the public know what's next, and again can get questions ready if they've got any. Yeah,
and we're just working on the terms of reference for rural. Yeah, okay, all right. So Simon, questions?
We've got 2 questions.
Right, okay. Just pop them up. Hi, my name's Julia. I'm the Police and Crime Commissioner for North Yorkshire. We're here at Elville Park in Skipton, in the skate park. This was built relatively recently with funding from a whole range of different sources, but including my community fund. And the community fund really is there for local people to come together and say, right, we've got a need in our area to try and help keep us safe or make us feel safer. And you can come to my website, apply for some money, maximum of £20,000, and see if you can get a fantastic facility for young people in your community, as we've got here in Skipton. Okay, so we've had 2 questions, both of which are in relation to item number 5, the Kirby Misbeaton item. The first one is, does the Chief Constable believe North Yorkshire Police are adopting a neighbourhood-style approach to policing KM8 as promised by Superintendent Dave Hannon? And the second one, well, let's deal with that one first, shall we?
Yeah, I suppose on behalf of the Chief Constable in his absence, I do know and listened to Radio York when he was on a couple of weeks ago on a Friday morning, and I think he spoke extensively for up to an hour on the subject of Kirby Misbeaton. He absolutely believes a neighbourhood style of policing. We talk about neighbourhood style policing at that site on a daily basis. Superintendent Dave Hannon is the Silver Commander that Phil referred to earlier, who is the consistent Silver Commander for that operation. And yes, on behalf, I can't speak for the Chief, but my belief from my involvement as a Chief Officer team is we're adopting a neighbourhood policing style, and that is included in the briefings to all of the staff. And you will have heard on the radio from Radio York programme that the Chief was on that he alluded to that in some of the answers to his questions.
I suppose, I mean, what people will see are some of the sort of policing tactics that are being used that are public order tactics that are not sort of normal, quote unquote, in neighbourhood policing, and perhaps that's what that question is alluding to.
I mean, in terms of neighbourhood policing style to the site itself, we have liaison officers as per the national guidelines and policy. We are there to engage, speak with and support, as ACC Kane pointed out, support the whole community in its widest sense. And neighbourhood policing is about communities, whoever those communities associate with. So we deem all of the people involved in this operation to be communities in their own right, and neighbourhood policing is about adopting a style suitable to meet the needs of those neighbourhoods in their widest sense.
Okay, thank you. And the second one then is how many people have been arrested and then de-arrested?
Okay, so obviously the arrest figures were provided in the presentation earlier. My eyesight's going, but I think it says 26 up on the board there in terms of 22 charged, 2 cautioned and 2 no further action. In terms of the specific question of a de-arrest, first of all, you would have to want to define what you mean by de-arrested. So when somebody's arrested before they arrive at the custody suite, we then decide that the grounds are no longer there and the arrest is removed, or when they present in custody, the custody sergeant makes the decision that the grounds to detain are not met. I don't have those figures with me. Okay. We can find them out, but I would define de-arrest to be those 2 categories, and they're 2 different things. Okay, all right, so let's see if we can provide that information.
Okay, thank you. All right, so that is it. Unless anybody's got any other business. Nope. Thank you very much.